So, welcome to the DrDoctor podcast. I'm Tom Witcher. I'm the CEO and founder of DrDoctor, and we're here today to talk about digital mental health with the team from Oxleas. Really delighted to have you in the room with us today. So we have Alison Furzer, who's the CDIO, and James Woollard, who's the CCIO of the Trust. James, would you like to tell us a bit about yourself?
Yeah, so I'm James Woollard. I am a consultant child and adolescent psychiatrist working in a ADHD team in Greenwich, which is one of the boroughs that Oxleas look after. I'm also the Chief Clinical Information Officer, Caldecott Guardian and Clinical Safety Officer in Oxleas, which gives me those kind of three different perspectives on digital transformation in the organisation.
Thanks, James. There's a lot of hats there. And Alison, delighted to have you here.
Yeah, thanks. I'm Alison Furzer. I'm the Chief Digital Information Officer at Oxleas. So I look after all of the information technology, digital transformation and our data services.
Excellent stuff. So Alison, we're really excited to be working with Oxleas. Can you just give people listening a bit of context about the Trust, the population they serve and the services that you offer?
Yeah, of course. So we're a medium-sized trust. We look after a variety of different services. So we look after mental health in South East London across the boroughs of Bexley, Bromley and Greenwich. But we also look after physical health as well in Bexley and in Greenwich. And on top of that, we also look after offender healthcare services. So we have a presence in quite a number of prisons now, both in London, in Kent, and more recently in the southwest of England. So we look after healthcare in 10 prisons down there now as well.
Wow, so it's a real breadth of services you offer.
Yeah.
One of the things about Oxleas is that you were very early on your digital journey in terms of not just in mental health, but I would say across the NHS. Can you tell us a little bit about the Oxleas journey through digital mental health services?
We've had an electronic patient record in Oxleas for almost 15 years now. I think certainly it feels...
Near 20, I think.
Nearer 20,
Wow.
So there we go. So a long time. And we were one of the first trusts to adopt electronic patient records. So if we've always been a kind of relatively early adopter in these things. I think if we're looking specifically at digital mental health, so thinking about how we're using digital technology in mental health services, I think we tried a couple of things even before I joined the Trust. So there was an app called Buddy app, which was about sharing information or getting feedback from patients via text messaging services. So that was kind of one of our forays, and we've got I think we learned some lessons there about engaging and kind of with suppliers and how we continue, and that's kind of helped us kind of learn those lessons going forward. I think we then, when I came into the Trust, which was in 2015, I wasn't Chief Clinical Information Officer then. I was just a consultant child psychiatrist coming into a ADHD team. And when I joined the team, we were a relatively small team. We had a relatively small population, certainly compared with where we're now in terms of the patients we're supporting. Probably hundreds of patients rather than thousands of patients, which is where we are now.
Yeah.
I have to say, I joined the team, and one of my colleagues, Dr. Nicola Reynolds, who's a psychologist, who's the team manager, and I just seemed to kind of come up with this idea around how do we engage with our population of young people and their parents who are kind of quite digitally savvy. They all play computer games. They've all got mobile phones and smartphones. How do we engage with them differently? And there was a Health Foundation grant at the time, Health Foundation sort of competition for grant funding. And it was one of those things where I think we just put a bid in for like almost like a minute before the deadline. And we weren't really expecting very much. And we put in this bid to say, right, can we do something around a digital platform that helps us communicate and engage with our patients and families differently? And we got the bid. And we were like, okay, now we've got to do something. So it was really quite a kind of, at that point, nobody was really talking about patient engagement platforms. No. I think there were a couple of companies in this space, but our colleagues in South London and Maudsley Trust had already started working on the Health Locker project, and I'd built up sort of relationships with the kind of senior digital leader in Health Locker, in South London and Maudsley, and so we had a conversation saying, can we kind of, like in a very NHS way, borrow your technology? Yes. So that their sort of Health Locker platform became the kind of base for what we then developed into what we called Headscape Focus.
Right.
So we already had a website in Oxleas which was focused on engaging young people in children's mental health which was called Headscape for our CAM services. We called it Headscape Focus because it was kind of keeping it within the brand, but then the focus bit, obviously we're thinking about children with ADHD. And we did some code design or some user-centered design workshops with our young people to try and understand what they wanted. And we then sort of developed a few more features with the Health Locker team in terms of looking at how we might message. So one of the key things we were keen to was to try and understand a different way of, not having to rely on sort of patients or parents phoning in via the telephone. And often our telephone, parents complained, we can't get you on the phone line's always busy, email wasn't secure, so can we send you a message? So one of the key things we developed was this messaging system. I think the other elements we had there were things like patient diaries, so they could record their mood or their level of hyperactivity, their sleep, which is important in ADHD. And so we implemented this with the Health Foundation funding, and this is sort of 2017-ish. Okay. And it was slow to start off with, but by sort of 2019, 2020, I think after a good few years, we had quite a reasonable...
decent uptake of it.
Uptake. And just to give you an example of the feedback we got from a parent, we try, I think one of the things I'll say is we had to use paper-based questionnaires to get feedback on our digital product, and I think there's an interesting kind of reflection there about NHS kind of transformation there. But one of the feedback we got from one parent was, I really like the messaging system because I can send a message whenever I like, and even though I know you're not going to read it immediately, I know you're there and you're looking, and you're like, it's that sense of being held in mind that I think the platform brought to a number of families who really engaged with it in a active way, and they would send us updates and things like that about how young people were doing, and it allowed us to work differently with those families.
You're bringing them into the room in a way that you hadn't been able to previously. So you're sharing a platform with Slam at this point. Common architecture. Focused on CAMs, particularly in that vertical still at this point, or have we broadened out?
Just focusing on ADHD at the moment. So not even our CAMS population, just on this kind of population of young people experiencing or on the ADHD pathway.
And I was going to say, no, I think we knew James and the team were working on this and had been working on it for a number of years. I think by the time we started to think about broadening out across the organisation, we were aware that a lot of the work that we'd done in terms of digital had been focusing on our staff and not our patients. And just before the pandemic, we've been listening to James and the work that he'd been doing and thinking about how can we create a patient engagement platform for the organisation. So we had a very skilled project manager at the time, Laurel Morgan-Bruce, who kind of captured the requirements of the organisation, enabled us to think more broadly about how we could roll out an engagement platform across the organisation. This was just before the pandemic, of course. I remember sitting in a room with patients and with staff and suppliers thinking about the supply that we needed to provide the platform that we wanted to deliver, and also listening to our patients in terms of what they wanted. And Laurel was great in terms that she brought a lovely team together of patients and staff from across the organisation to kind of help develop what turned into our first foray into Oxcare, which is our patient engagement platform.
Amazing. And I love the fact you're bringing patients into the room and co-creating early on, because I think that's often strongly correlated with digital projects that have success. And it's interesting hearing this story because there's a huge number of parallels to the DrDoctor story, actually. We started in 2012. As you say, in 2015, no one was talking about this stuff at all. And we ended up doing the same. We ended up bringing in lots of patients to help us co-create the first versions of what's going on. So we're in 2019, we're getting quite excited by the concept of patient engagement, starting to think about what we might build, and then the pandemic happens. How does that change the plans?
I mean, I think we'd done some of the early work prior to the pandemic. I remember Laurel and the team being in a room, lots of post-it notes, thinking about the functionality that we wanted to create. It was more tricky, I think, to launch during the pandemic.
Right.
In terms of engagement with staff, everything was moved to virtual. But we quite quickly, based on the work that James and the team done, we got a product out there.
Yeah.
I think we had quite a lot of patient involvement. Patients told us that they actually wanted to sign up for Oxcare, and that's the model that we went down. So during the pandemic, we spent quite a lot of time thinking about how we could get patients to sign up to Oxcare and receive information like letters digitally. And there was a huge amount of functionality that sat within that platform. And to be honest, I don't think in that first foray, we perhaps exploited it as much as we could do.
Yeah.
It was a challenge rolling it out during the pandemic, but I think it was a challenge that the team rose to. And we did, in certain areas, see really good engagement, but it was in pockets, if I'm honest.
Did it give it more impetus, the pandemic? Did it help kind of accelerate the desire of the organisation, or did it just put blockers in the way? Because we found both.
I mean, I think in terms of thinking more broadly digitally, the pandemic enabled us to start to think about virtual appointments. Yeah. We saw a huge rise in the pandemic of the number of virtual appointments that we did day to day. So certainly, enabling the organisation to think digitally, the pandemic certainly helped us on that journey.
Yeah.
In terms of the patient engagement platform, again, I think we saw pockets, some areas really engaging and others perhaps not.
Yeah. And what were the blockers in the areas that weren't? What holds people back from embracing this sort of technology?
I think it's often about the fear, certainly in clinical teams, it's about the fear of having more demands placed on them. So, for example, let's take the messaging functionality, which is often one of the ones that people were most kind of worried about. Was, we're going to get messages all the time. We're going to get, bombarded by it. How are we going to cope with that? And the reality is, for us as the ADHD team, and it was more about channel shifting. So rather than phoning our admin team constantly, they were messaging into the clinicians directly, and we could respond. So actually, you're taking a step out of the loop. You're helping with engagement. So I think, but that fear amongst some of our clinical teams about having that extra bucket that they had to check. So you've got your email, you've got electronic records, you've got your own diary, and then you've got this new messaging system. I think the other challenge was just in that sense of capacity for change in general. And I think that is one of the things around the pandemic. People were so in that survival mode. They were having to engage with video calls. They were having to engage with remote working. And then we're saying, and here's a whole load of functionality on our patient engagement platform, which you could use. And again, I wonder if that was part of it. It just felt like there was too much going on at the time for some of the teams.
I think that change fatigue point is a really key one, and it's something I really want to talk about a bit later, actually. But I'm particularly interested in the words channel shift you used there.
Yeah.
Because certainly when we think about the DrDoctor platform, sort of the foundational slice of it is channel shifting patient behaviour. Talk to me a little bit about kind of how you view a patient engagement platform. Like, what are the core components in it, and how do they come together?
So I think this was the conception we developed, I've developed through the ADHD, the work that we've done around ADHD, and then into Oxcare, and then kind of thinking further forward. And I suppose I see sort of three elements. One is those kind of logistical elements, like sharing when your appointment is, how you might get to your appointment, the letters that we've got. Then the next bit is that communication element. So the questionnaires, so sharing the opportunity for patients to send information to us ahead of an appointment. So that might be about how they're getting on with their medication. It might be telling us more about why they've been referred, giving us their perspective on what the GP has written in the letter. So that communication element. And then that goes into the messaging stuff, like give us an update on how you're getting on with your medication. And then the third bit is that therapeutic bit, which is about that kind of active push or active access to much more therapeutic content. And we did all of that in Oxcare in terms of, we had a whole sort of video channel, if you like, where we posted videos about various sort of self-management approaches and information for patients. So we did really try and address all of those three elements through our through Oxcare at that time. And like I say, I think there was kind of different uptake across different teams of those different elements.
Yeah. I mean, and certainly those three slices, again, very much match how I think I view the world. You've got channel shift, patient engagement, try and change the way people think about how they're going to engage with the organisation. And that drives like really significant savings. Then I call it back office automation, the logistical bit, you know, self-scheduling. And for me, scheduling is so important because it's the common currency across all of healthcare is at some point I'm going to have to make an appointment with someone, even if it's a virtual appointment, I'm going to have to make an appointment. And if you can automate that step and give some agency, it connects up so many dots and is a really powerful way of driving the return on investment, I think, for organisations. And then you have the therapeutic or kind of the more hybrid models where you're starting to provide care in different ways, which is super exciting. So you've built this sort of all three slices. You've got loads of functionality in there in Oxcare. Still on the same platform at this point. Still on Health Vault, I think it was.
So still on the same platform. And I think, as you mentioned earlier, lots of functionality in there. Probably a little bit too early for the organisation. So much of what we think about, well, when you think about digital tools, a lot of, you know, the ideas are great, but it's that cultural change that you need to make sure that you embed. And for, you know, there was for a variety of reasons, we didn't get to the point where we were able to really make that cultural change. Now, unfortunately, the supplier we were using went into liquidation. We had to go out again to find a new supplier, hence DrDoctor.
Yes, there we go.
And our approach this time is much more focused. So initially, we're just working on the patient appointment letters. We want to get good uptake of patient appointment letters, and then we want to start doing the other things that we've done previously. So I think we're making good inroads in terms of adoption. I think I saw the latest figures for September. We're nearly at 44% uptake of digital letters across Oxleas. And we know there's more work to be done culturally with our staff, but also with our patients, so that we can increase the uptake further.
Brilliant. And you know, for context, we think that's about 21,000 letters so far, and we're pretty early on, so that's awesome. And 44%, which I think is fantastic uptake. Obviously, there's a chunk of people there that aren't engaging yet. What do we think is holding people back? What do we think is the...
So, I mean, from my opinion, I mean, so I think there are about 30% of our letters that are going out through Oxcare that are not being picked up. So I think that maybe we don't have the right email, maybe we don't have the right telephone number. So there are things that we need to do with our patients. I also think there might be some cultural work we need to do with our patients. We were talking in the team the other day around the cost of using the post versus the cost of Oxcare. So someone was telling me that to send a letter second class costs 84p, to send it through DrDoctor costs less than 4p. So, you know, to let our staff know that, to encourage our staff to send more letters through Oxcare is one thing, but also should we be letting our patients know that? You know, to send a colour letter costs £1.77. You know, if patients were aware of that, they might decide to look at the information we're sending them through Oxcare. Now, appreciate that not everyone wants to receive their letters in that way, and 1% of our patients have opted out. So we know that this doesn't suit everybody, but actually, if you can get your letter digitally, you get it immediately, and it's there for your record. Whereas if you get it in the post, it could be late. You might miss your appointment. So there's many reasons why people may want to engage digitally.
I think what's interesting, I've had, when I've explained that we're sending letters digitally now, parents, certainly the sort of parents of the young people that I see, oh yeah, we get our letters from Lewisham and Greenwich, one of our neighbouring trusts, you know, the same way, or King's College and Hospital and Guy's and St Thomas's. So there's also that sense that they're familiar with that approach from other organisations. Now, it'd be interesting. We haven't looked at this, but how many, you know, perhaps we could do a survey of some of our patients and say, are you getting your letters digitally from other organisations in South East London? So there's a sort of, you know, we can get that sense of, are they already engaging in this way? And then if there is a difference, like why would you not want your mental health letter digitally? Is there something different that people want somehow, a physical, I don't know. I'm kind of thinking out loud about that. I think one of the things that we've been talking about is also the use of the NHS app.
Yeah.
So we know in Southeast London, I think we've got reasonable uptake from the NHS app data around people signing up. So can we start to get a sense of how many of our patients and carers are using the NHS app? Because that might give us an indication of, are they ready? Because if you're not using the NHS app, maybe you're not quite as ready as somebody who is to get your letters digitally.
And the NHS app is a really important part of this journey, I think. You know, those of us that have been doing it for a long time and had that early vision, it's fantastic seeing NHS app become national policy, right? It's a pretty good validation that you were doing the right things in 2015. We find in areas where it's really well used, so in Birmingham, for example, in the acute side, people who have the NHS app will read push notification, will look at a letter in the app, but it's actually only about 16% of the total population that are choosing that route over the other routes. So we think it's a powerful, very trusted front door for lots of journeys, but it doesn't hit the long tail.
Yeah.
And I think a lot of what we've sort of been talking around the edges of here is actually you've got to try and get scale in these products as step one. Because if you haven't got scale, the organisation doesn't get the ROI and you can't actually do the big clinical cultural change piece.
Exactly.
So I think it's really critical, but it's part of a sort of mosaic of different ways of patients are going to engage with your organisation.
And that's why we want to, I mean, ideally we want to get to 70% adoption before we do some of these next steps in terms of questionnaires and what have you, because the ROI will stack up if you've got more adoption of simple things like letters.
Exactly. And when I started DrDoctor, I never thought that I would spend so much time thinking about letters. I really didn't at all. But we've realised that like this, if the base of your pyramid isn't there, you can't do any of the other change. It's so important. And it matters to patients. Like, where am I going? Why am I going there? Let me know. Make it timely. And it's one of the few things you can do that actually saves money and improves patient experience, which is pretty cool.
I think there's a huge amount of reflection we could do around habit formation and creating those kind of, I sort of think of them as like sort of grooves, if you like, that people are familiar with, going to DrDoctor or the NHS app or DrDoctor via the NHS app, in terms of having that behavioural groove that they constantly kind of, and it gets deeper and deeper, and that just becomes, that's the way they engage with it. And I think it's letters of that initial way of getting, like, they're transactional, they're meaningful, it's important. It's, you won't get you won't know about your appointment unless you engage with this. So, I think there's that motivation piece, around why is it important for me to engage with this? Because then I know when my appointment is, and I won't lose my letter. That's the other thing I think we haven't perhaps highlighted. Is click on this, you'll never lose a letter again.
Exactly, they're all there for you.
I mean, and we've been doing those little nudges, haven't we? So the text messages that we send out to to patients now for them to pick up their letters. I know we've been working with you to change the time. So I think initially we were sending some letters out at midday and the rest out at 6 o'clock in the evening. They're now all going out at 6 o'clock in the evening.
Interesting.
And we've seen a slightly better adoption rate with the text going out in the evening. So I think, there are those kind of little nudges, those marginal gains that we've been making as we've been noticing behaviour from both our staff and our patients.
And I was going to say, and I think you can see how we can take that a step further in the future. I don't know, is test out, if we gave patients the option to tell us when they want to get that notification, because for some people it might be 8 o'clock in the morning, for some people it might be 7. So how do we go from a kind of one size fits all approach of we're going to send everything at 6 o'clock to that kind of precision approach of how do we make it more personalized for you? But I think the challenge for us is that where we invest our kind of time and money, if you like, or is it moving on to something else? I don't know. Yeah,
but that's the beauty of digital, isn't it? You can personalise more. So, all of those things could be options in the future, and, and you can program that to be, different solutions or different times for different patients, etc. But I do think digital in general provides you with, or digital tools provide you with that ability to personalise. But what I do like about DrDoctor and the way that we're delivering the letters now is that it's digital by default. To start with, but if you don't pick up your letter via email or text, you still get the paper. So it meets the needs of all of our patients.
Yeah, designing those fallbacks is really important, I think. And the behavioural change part is I think the centre of all of this. Actually, if you can if you can personalize, that's fantastic. And I would love to explore with you guys WhatsApp and rich text messages and all of those interesting things. But I think they're in the optimization phase. It's right now, it's about how do we create that behavioral and cultural change. And I'm particularly interested in mental health and also in community organizations. We tend to find rolling out tools like digital letters takes longer. It's more complicated. I think possibly there's more smaller services that have more independence. I'd just be really interested to hear your thoughts on the cultural change and behavioural change from the staff and internal side as well. What can we do in complex organisations to make the rollout happen more quickly? And is my assumption right there?